So, as programs start to make these changes, start to think about what they could do to increase access and responsiveness for survivors who use substances, some of that can feel hard. Some of it can feel like, wow, we barely have what we need to respond to what we're currently doing. And this is something that we're kind of adding on top of that. And for some programs or advocates, that might even just feel scary. And
Mhm.
so, what, as you've developed and instituted these incredibly innovative practices, what has been the impact that you've seen on your staff and on survivors? What do programs have to look forward to as they embark on this journey?
The f A few years back when I first got involved in this more specifically, this always has been something I've been focused on, I guess, in a sense, because I always felt like there was a lot of challenge around substance misuse and just so much judgment on the survivors. And I mean, they're already getting judged a lot of times for the domestic violence, and then we pile on the substance misuse or a mental health issue. So when a few years back, whenever I got the opportunity to implement a organized program in shelter with a therapist that was on staff to be able to help, we created groups and we had time to play with it and see what really worked. And what was really interesting to me was that prior to that program, when somebody came in that had a substance use issue, if there were other people in the house that had been clean or had maintained their sobriety for a period of time, a lot of times the whole house would kind of relapse. When that first person would come in, there would just be this kind of a mass relapse. After this program was implemented and we had that therapist and we were running groups and there was just this conversation that was just integrated into everything, we didn't see that happen anymore. And what was really cool were the survivors that were in shelter who were working on their sobriety were really the ones that drug the person that was still using to the groups. So there was this peer support system that came from it. And it actually made it to where sometimes I didn't have to be the one to have the conversation because the other women in shelter living with them would be the ones having some of those hard conversations with that person. And we made sure that you didn't have to be clean to be there or come to groups or participate. But we really just wanted honesty. Be honest about it. We're going to talk about it. And there were several women that started the groups who remained actively using for several weeks coming into the groups, but ultimately would abstain and just started maintaining their sobriety, and they had a safe place to talk about it. So I think that was the biggest impact, was seeing how that atmosphere changed the women in their ability to face this challenge and to maintain sobriety and have people that they really could depend on, people that were calling them out sometimes too, but also really supporting them in a good, healthy way. And then for the staff, they started seeing it differently. They started seeing it from a different perspective, and they started, I think, hearing the challenges that the survivors were facing a little bit. I saw less judgment from them and more ability to speak openly about it and to have a conversation when they needed to with survivors that they were serving. I think it made a better atmosphere. It made a better environment for really everybody. There wasn't that challenge and that back and forth, or the people making assumptions about what was happening or about what survivors were doing or about what they were thinking or what their intentions were. We were talking about it, and the survivors were given a space to say whatever they wanted to say, even if we didn't like hearing it. And that helped. In the long run, it made the environment a lot better. It felt better. It felt more empowering.
Mm, yeah, and just so much more aligned with what brings us to this work. Right.
Mhm. Yeah, some equality, really. You could feel the equality with this with the advocates and even the survivors too. You know, everybody started seeing each other from an equal playing field, I think, in a way. I think that helped a lot too.